In Latin America and the Caribbean, as in other places around the world, the coverage of health services is compromised by inequalities. While some enjoy easy access, others are limited by factors such as travel time and the resulting travel expenses. These factors affect the many sectors of the population differently, perpetuating systematic inequities in gender, ethnicity, age, or educational level, among others. Inequity is a challenge for social welfare, urban planning, service providers, and for development in general. Within urban planning, each sector works with different data and approaches, limiting the cross-sectoral cooperation needed to achieve equity in the accessibility to health services. How can adequate and equitable accessibility to health services be achieved for all populations? In the event of public emergency or an unexpected change in conditions, where can responsive services be placed to achieve the most coverage? The AMORE Project seeks to solve this challenge by facilitating cross-sectoral collaboration, providing accurate data for common use. If we visualize the travel times needed to reach services and their impact on equity, it might be possible that the different planning sectors adopt a common focus, promoting consensual, effective, affordable, and prompt solutions. The proof of concept will be carried out in Cali, Colombia, where 3 elements will be investigated. First, the current accessibility to specific health services will be reviewed. This will be done in conjunction with those involved in urban development as well as those offering and using health services. These groups include the authorities, civil society representatives, and service providers. The current accessibility and its impact on equity will then be evaluated, while considering the planning strategies in place. Lastly, the interest in adopting this approach for cross-sectoral collaboration will be measured. Using this information along with analytical tools, solutions that optimize travel times and service locations will be presented. The solutions will consider the service offered by different health institutions to identify and facilitate accessibility to essential services, such as complex emergency care, hemodialysis, radiation therapy services, or vaccination posts. Using innovative, accurate, timely, and low-cost data, the AMORE Project will test an alternative to informed decision-making that benefits equity and contributes to public policy development. This approach can then be applied to other public goods, helping communities to advance towards their sustainable development goals. It can also be extended to other locations, cultivating a more equitable society that advances the United Nations Agenda 2030.